Hello, you must be my first client. Can you just confirm your name and date of birth, please? I believe this is actually my first cranial nerve exam. Yeah, so your name and date of birth anyway. So, I couldn't tell you a single thing about cranial nerve exams, but I'm just gonna wing it and hope for the best. So, I've got my mask right here. I'm gonna take my glasses off because whenever I wear a mask with glasses, it just steams right up. Anyway, so that's the mask. And then we've got gloves. Now, I don't really know why we have to wear gloves and masks, to be honest, but I'm assuming it's some kind of policy that I probably should have read and I didn't. I actually just put like in a fake CV and said I'd gotten all these degrees and I forged them all, and yeah, here I am with a pretty high paid job and no clue how to do it. So anyway, like I said, I'm just gonna wing it, and I found this pretty cool thing. I think you listen to your heart with it, I'm not quite sure, but anyway, so like I said, I have no idea what a cranial nerve exam is or how to do it, but there's some equipment laid out here and we're just gonna hope for the best. So to start with, I guess we're just gonna test your hearing maybe. To begin with, can you tell me if you can hear me right now? Well, that's good. Maybe I don't even need to do the test, but I will anyway. So I'm assuming this is of some use to your hearing. I don't know. I'm gonna hit it and see what happens. Yeah, so just tell me if you can hear this, really. I mean, I know I can, so surely you can too. You can hear it? Well, that sounds good to me. Excuse the pun. Okay, so let me just make a quick note so I don't lose track where I am. Hearing check. So eyesight. Close your eyes, I guess. I'm gonna do another test for your hearing. I want you to tell me what item you think it is that you're hearing, if that makes any sense. So yeah, eyes closed. What do you think that item is? Yeah, you're probably correct. It would be sticky tape or sellotape. So, eyesight. I mean, considering I put this mask on, I'm not even using it, so I'm just gonna put my glasses back on so I can actually see what's going on. So yeah, I have like 10 fingers here. Just follow this. No, actually we'll go with this one. Yeah, follow this one. Just wherever you can. I don't really know. We're just gonna change up and go to this one. In fact, I'm actually just gonna get you to follow the toilet roll tube, you know? Just follow the toilet roll tube with your eyes. It's really that simple. If you can't see this, then like, I don't even know. Excuse me, my friend just texted me. I better respond. Yeah. So like you said, we've done your hearing and we've we've so far acquired that you can hear, and well, I think you can see as far as I'm aware. So, I've got this cool colour blindness book that I think might be an idea. So, this here, as you can see, is a red triangle and square. So, just out of curiosity, can you taste the colour red? You can? What does it taste like? I see. That sounds pretty good. Okay, well, tell me what colour this one is, please. This triangle. What colour is the triangle? It's green. Yeah, see, I knew you weren't colourblind at all. So, tell me if you can see anything on either of these pages. You can't. Okay, we might be colourblind then. Right, that could be a cause for concern. See, I don't even know what cranial nerves are, what they're testing. Let me just have a look in our supply drawer. I found this nifty pair of sunglasses. I'm gonna pop them on you and then I'm gonna check your eyes with the torch because I think that sounds pretty good, you know? Okay, let me just find the torch. So, here's our torch. Can you see that? Perfect. Okay. Well, I want you to just look at this toothbrush. Just keep your eyes on the toothbrush. I know. So cool. And I'm just gonna look in your eyes. Just keeping your eye on the toothbrush. You know, I don't think you have eyes because I can't see them through the glass. Maybe I've done something wrong there. Should be concerned about blindness then too. So I don't even know if like I need to be wearing these sunglasses, so I'm gonna take them off you. I'm actually gonna check your breathing because I have no idea if that's like associated to cranial nerves or not, but I found this like peak flow meter. It's just really to test your breathing, I think. I used to use one as a child because I was an asthmatic, so I think I know briefly about these. Anyway, I just want you to blow in there for me. 350. I don't know if that's good or bad, but I'm going to say that's a pretty good breath that you've taken there. Yeah, so I think your breathing is good. Hold your horses whilst I Google what cranial nerves actually are. Okay. Well, that's just complicated. It looks like it's like a group of nerves that controls everything in your head and brain. That's just too much for me to comprehend on my first day of the job. So I'm just gonna take your heartbeat instead, because I think that's a good test of cranial nerves. hear your heartbeat. That either means you're like a horrible person because you have no heart, or you're dead, and I didn't really know that to begin with. I'm going to test again. I think you're meant to test the heartbeat in the neck. It's like pretty close. I just can't hear any heartbeat. This could be a code blue. Oh my goodness, we get to say code blue like in Grey's Anatomy. Where's the button? Where do I press it for code blue? There it is, code blue. Help, help! This patient has died on me. Well, they're not responding, I don't know. Maybe I should perform CPR. Okay. Hold on, I've got just the trick to wake them up. Some incense. Or, not incense, essential oil. I've seen this in the movies. Wake up. Wake up. Look at that, I'm so smart. I saved a patient today. Well, I know what I'm going to do to test the cranial nerves. I'm going to brush the brain. Yes, we'll brush the brain. Brush, brush, brush the brain. Brush, brush, brush. Can you feel that on your forehead? You can. Okay, that's a good sign that you're alive, I think, then. We're just brushing the brain. Brushing the brain. Brush, 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 brushing the brain. Yeah, I mean, if the cranial nerves are connected to the brain, surely if we brush the brain, that's gonna test something, no? What else do I have in my medical kit? What's this? So it looks like some of the cranial nerves is testing facial sensation. I don't even know what that means, but I'm assuming the toothbrush did that job. But I've got this cool little blowing thing. Tell me if you can feel the air on your face. You can. That's good. You know, I don't think there's anything wrong with you whatsoever. I'm gonna check your eyes again without the sunglasses on. I don't even know what I'm looking for, to be quite honest. Well, their eyes look like eyes. There's nothing odd about them that I can see. So, I mean, that gives me some kind of reassurance, you know. Let me just Google what should your eyes look like. Well, I should be concerned if they're like red and bloodshot, apparently. But they seem to be fine. I don't really have the proper equipment to do like scans and stuff, but you know. Maybe I ought to pick your brains. You know, like the Egyptians, they used to pick the people's brains through their noses. That might be exactly how we test it. So I'm gonna pop this up your nose. Can you feel that in your brain? I can feel your brain. Do I start pulling it? I think my is another code blue situation. Oh, I know. Check pulse. Oh, I feel something. Well, that's good. That means they're alive, so I shouldn't be concerned. Yay. Okay. Well, that's good news. You know, from my observations, my professional observations, might I add, I think I can declare this patient deceased. But they passed their cranial nerve with flying colors, flying colors. Oh, I know. I also have to call time of death like Grey's Anatomy. Time of death, 7:25 p.m. I am definitely going to make the best doctor ever in this new job. Just, their eyes have closed. Let me just touch their eyes with the toothbrush. No, I think picking someone's brains out was just a step too far. I feel awful, but I don't know whether I should tell my supervisor that I was unqualified for the job. They're dead. They're ringing me. They're ringing me. Hello? Yes, this is trainee Dr. Carla. Oh, I was on tea and coffee duty, was I? Oh, yeah, I'm not in the hospital anymore. No. No, I went home. Yeah. I see. No. Yeah. This this job just wasn't for me, I guess you could say.